So we're here with Dr. Davy, and she's a registrar with a special responsibility for infectious disease. There is a concern concerning tuberculosis. Part of it may be a misconception, but we would like you to talk to us a little bit about this and to clear up any misconception of the concerns people may have regarding that there is an outbreak of tuberculosis in St. Vincent and the Grenadines, particularly at any of our institutions here in St. Vincent.
See, I must say that there is not an outbreak of tuberculosis in any of our institutions across the country. What has happened is that some persons were concerned about their TB, their tuberculosis status. So a few of our colleagues, they had a skin test, and a few of them have a positive skin test. Having a positive skin test does not mean active TB disease. It simply means that that bacteria is hiding out in your lung or somewhere in the body.
Can you tell us a little bit more about what does that mean? Does it mean that they just contracted it? Does it mean that they could have had it before? What does that means exactly, and what should they do?
So firstly, the transmission of tuberculosis happens when somebody has the disease and they cough, talk, or laugh, and it goes to your airway, it goes to your alveoli, which is in the lung. Now, it takes more than a year for this TB to actually have effect on the body. So persons who are now testing positive for tuberculosis through a skin test, they're testing, that is just a skin test, it's not saying that you have the active disease, they would have had the bug inside of their body for about a year. So it's not a new infection that they got from anyone.
Someone is tested positive for it on the skin or in the skin test. What is the next step? Are they fine? What do they do about it for it to not become active?
So after having a positive skin test, those persons would receive a chest X-ray. And the reason why they're getting a chest X-ray is to look to see if the TB has had any effect on the lung. Because at that point, that's what we call latent TB. It's not contagious, it's not infectious, you can't pass it to anyone. So if you have a chest X-ray that is negative with the positive skin test, you would get a 6-month therapy of a drug called isoniazid, and that would get rid of the bacteria altogether before you present with active tuberculosis disease.
Is there any truth at all to any case of tuberculosis that was present, and how is it possible that these persons who are presented with a positive testing for it via the skin test, how is it possible that they could have contracted that?
So annually, we have a few cases of tuberculosis in the country. Last year, 2018, we had 6 cases. Prior to that, we had 3 cases, 6 cases. So annually, we ranged less than 10 cases, but every year there is at least 3 cases of tuberculosis in country. So persons who would have been coughing for a long time, or healthcare workers who may have been exposed to someone with TB, those are the persons who can have latent TB, but not have signs and symptoms. So it's around, and it's just left up to us to control this disease.
How can we control the disease? What is it that people need to do to ensure that they don't get active TB?
So firstly, if you're around someone who's coughing, you have to get them attended to ensure that they don't have disease. For every case of tuberculosis that we encounter in country, we do what we call contact tracing. So we go looking for their family members, their coworkers, and their friends. And I know at times people run away from this screening, and then a few years later, they're coming down with the disease themselves. So when you hear the nurses are coming for screening because there was a case, please don't run away. Have your screening done. Healthcare workers should have their screening done routinely as well to ensure that they don't have the bug laying around in their lungs, so we can treat them before they have active disease.
Reiterating, we just wanted to clarify again, because we just want to make it clear what is the status of our healthcare system as it relates to active tuberculosis, and what is it that we need to do.
So we'd say again that there's not an outbreak of tuberculosis in any institution. We do have cases of tuberculosis in country annually, but they're found, they're treated.